Good afternoon. I want to welcome you to our Thursday press briefing with updates on COVID-19. As of this morning, we have lost over 115 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I want to take about 4 minutes and talk about testing. One issue we've had is limited testing. And I went through the notes I've been maintaining throughout this pandemic. And if you will recall, in the first few weeks, there were only a limited number of testing kits available. As a result, the staff at Phoebe Putney were being, the term they used, judicious in administering the test. And that meant, since they only had a few tests, only those individuals who had the symptoms, which at that time were fever, cough, and shortness of breath, were being tested. As a result, there was a high probability of a positive outcome. Our ability to measure the number of people who had the virus was compromised in those early days because it was taking from 5 to up to 10 days to get the results from those tests. I was looking back, as we know, the Department of Public Health was also testing. Originally, the Department of Public Health had the same problem. We were using a commercial lab, and those individuals who were being tested, and at the early stages, only the people who could be tested at the Department of Public Health had to be symptomatic. They had the same problem with the slow turnaround. A positive development occurred on or about March 23rd. That's when Phoebe opened up the drive-through. The drive-through, as those of you who have utilized that option know, you go in, a sample is taken, nasopharyngeal. Dr. Black can explain it, what it is. It's not pleasant, but it's not the end of the world. Sample is taken, and there at Phoebe, you have the results within a few hours. I think, if my records are correct, some 3,000 people have been tested at the drive-thru at Phoebe Putney since March 23rd. The Department of Public Health, about that time, received an allocation of test kits from the federal government. You may recall that allowed the Department of Public Health to test first responders and healthcare providers, considerably expanding the scope of individuals who could be tested. Another positive development was on April 20th. The number was greatly expanded again because Dr. Ruiz has termed the generous criteria. About that time, on April 20th, anyone who's 60 or older, anyone who had a serious underlying medical condition, compromised immune disease, or a caregiver for one of those people, or an individual who needed to be tested to return to work could be tested at the Department of Public Health. Now, what has happened in recent days, and there has been some miscommunication, we'll address that. We in Albany now have the opportunity for anyone to be tested. Some commentators contend that it's absolutely imperative to have the ability to universal test. Why is that? A, because if someone has a condition which makes them susceptible to an unfavorable outcome, measures can be taken at the earliest stages to treat those people. Secondly, if an individual is young and healthy and may not have any symptoms whatsoever, the fact that he or she has the virus can be identified at the early stages, and that individual can be required to quarantine. We know this. Dr. Steve Kitchen, the Chief of Staff of Phoebe Putney, spoke weeks ago and acknowledged that even though individuals who are being tested in the early stages were instructed not to go out and about their business, that many people were not being compliant with those instructions. As a result, almost certainly, people were being infected by individuals who had been tested at Phoebe Putney and were awaiting the results of those specimens in the early days. Now, the miscommunication and has been, I've had friends contact me. Well, Bo, you said anybody can be tested. I called Augusta University, tried to schedule a time to go by the National Guard Armory test site behind the Civic Center and be tested, and I was informed I could not be tested unless I was symptomatic. Now, what has happened? The fire chief, who's the EMA director, Chief Scott, determined that the individuals who were screening the calls at Augusta University were not aware of the fact that here in Albany is an exception to the general rule that an individual must be symptomatic to be tested. So, if you call the number 706-721-1852 to schedule a time to be tested, all you need to do is let them know you live in Calhoun, Clay, Crisp, Daugherty, Dooley, Early, Lee, Macon, Miller, Mitchell, Randolph, Sumter, Terrell, Turner, Wilcox, or Worth County, and an appointment will be scheduled, and you will have the opportunity to be tested at no charge to yourself. We have identified the location. It is the 100 block of Mercer Avenue behind the Civic Center. It is open, I believe, between 2 and 6 every afternoon. And please, we ask that you call this number, 706-721-1852, to schedule a time. But if you are unable or unwilling to do so, you can go and the walk-ins will be tested. I want to say this. At our meeting yesterday, we were informed that more than 200 people had been tested, 70 of whom were walk-ups. Unfortunately, the National Guard ran out of tests. I don't think that's going to happen because we have had, now the National Guard knows of the demand, and we have the capability to perform the testing, and what we are asking you, the public, to do is take advantage of this so we can have an understanding as a community as to the prevalence of the rate of infection, but also for those who test positive, they can take precautions to protect themselves and others in the community. Thank you.
Thank you, Mr. Mayor. Now we will hear from Daugherty County Commission Chair, Mr. Christopher Cohelis. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. I want to, as always, begin by sharing my heartfelt condolences to the families that have lost more than 115 family members here in Daugherty County, and to all of our neighboring counties and the people in surrounding areas that have also lost family members. Our hearts are with you. I want to really emphasize today how important a resource it is that we have actually obtained the ability to have unfettered testing for any citizen in Daugherty County and in the surrounding area. No other area in the state has received this type of access to testing. It is an incredible resource, and it is one that we need to, as a community, to take advantage of. When we have a resource like this, it allows us to diagnose ourselves as a community. It allows us, irrespective of whether or not we feel like we're symptomatic, or whether or not we have a sniffle or a cold or a snotty nose or any of those things, it allows us to go and get tested. And why is that important? It's very important for this reason. We know that we have people that are completely that they're asymptomatic. They don't display any symptoms. They literally are going around each and every single day as if nothing is going on with them, nothing is wrong with them. Yet they have the capability of infecting other people. Two, this is a resource. We know that we're a hotspot, and at times have actually been number 3 in the world in terms of per capita infection. I'm going to repeat that. We have literally been at times number 3 in the world in per capita infection. We have taken swift decisions, made swift decisions, we've implemented rules, and we've started to flatten the curve. But we can actually take advantage of this resource so that we can diagnose in the community what percentage of the citizens do or do not have it. Allow the folks that do have it, that don't know that they have it, to be able to take precautions so that they don't infect other people. It allows us to have access to all kinds of data and research. There are people from all over the state and the country that are literally looking at Albany and Dougherty County and how it responds to this crisis. And rather than being defined by our adversity, we need to define ourselves by our success. We have asked for every resource known to man, every resource that we could get from the governor's office, from the federal government, from the local government. We've literally had the Department of Public Health double its contact tracing team. We have literally put into place orders that many other communities and counties did not do across the state. And we've worked very hard to get to where we're at today, which is we are flattening the curve. We're seeing the overall infection rate completely start to slow down. We're still seeing cases, and we're still seeing people that are on ventilators. But today, we have 42 people on ventilators, whereas 3 weeks ago we had more than 70. We know from the statistics that approximately 75 to 77% of the people that are on respirators will pass away. There are the fortunate few that will make it. And we want to lower the number of people that get on ventilators every single day. We want to stop or at least slow the infection rate. And I think it's very important for us to define what our goals are. You can't wipe out this virus in one day. It's not something like a tornado where it starts on one day and it ends on the next, and then you go and clean things up. This is literally something that we have to endure for a period of time. And in order to do that, what I know and what others know and what other officials have said and what we know from all of the different news accounts and the experts is this: access to testing is critically important. Access to testing for a large number of citizens is very important. Having contact tracing is important. Why is that important? Because the more people you test, the more people you identify that have the virus. The more people you identify that have the virus, the more people you can put into contact with the contact tracers. What do the contact tracers then do? They then contact the people who have been identified as infected, and they interview them, and they ask them, who are the people that you've had contact with? And then they identify those people. They contact those people. They tell those people to self-quarantine or to self-isolate. And that is how you slow the spread of the virus. So when I say it is critically important that we take advantage of the site that has been made available to us, and I want to thank the governor for giving us this resource that no other community has gotten, that allows us, irrespective of whether or not you have the app, irrespective of whether or not you have the symptom, irrespective of whatever, if you're a citizen in this community, you can go and get tested. And let me say this: you owe it to your fellow neighbor, your fellow citizens. I am going to get tested. I would encourage everyone in this room, everyone in this community, to go and get tested. It is important for us. It is important for our community. And again, the information, you can call the hotline or visit the Augusta University testing website at 706-721-1852 or visit augustahealth.org/COVID-19. There's also an app available for your phone by searching AU Health Express Care in the App Store. That's Very, very important information. For those of you that don't have smartphones, for those of you that do not have social media access, for those that don't have those resources and communication resources, make sure that your family members know about that. Make sure that the elderly know about it. That's important information, and we need to take advantage of this resource so that we can grow stronger as a community. Thank you.
Mr. Chairman, thank you for your remarks today. Let's move now to an update from Phoebe Putnam Memorial Hospital. Present today is Dr. James Black, the chairman of the emergency department at Phoebe Putnam Memorial Hospital. Dr. Black?
Thank you. I'm going to take this opportunity to remove my mask as I'm 6 feet away and give you the update. Currently, we have 82 COVID patients in the hospital, and that's down from a couple of weeks ago. That's almost half. We were housing 166 at the time. Total, we've had 2,305 positives and 4,739 negatives, with 191 cases or tests still pending. Over the last 24 hours, we've had 13 positive and 54 negative tests and 1 death. Those numbers are quite encouraging as we continue to battle this pandemic, and I certainly want to thank the citizens of Southwest Georgia and Albany, as this kind of success would not be achievable without the cooperation. But I also want to take this opportunity to say we're not done. And as we see other surrounding counties and surrounding states who are sending their numbers trend upward, it would not take very much for us to see a second wave or another spike in cases. It's imperative that we continue those safe practices that we have enacted over the past couple of weeks. And I am talking about social distancing. I know that the restrictions have been somewhat relaxed, but let's be mindful to only take advantage of that if it is absolutely necessary. And if you are going to venture out, make sure that you're wearing a mask at work or when you're out from the house. Make sure that you're washing your hands frequently with soap and warm water or using hand sanitizer. Let's also resist touching your face as much as possible, particularly if your hands have not been recently cleaned. And again, maintaining a safe distance from others. And if you must patronize businesses, try to patronize those businesses that are doing the same or they're placing an emphasis on keeping you safe. So making sure their employees are wearing masks, making sure they're adhering to the 6-foot rule, making sure they're cleaning those surfaces frequently. Again, we've done a tremendous job, but I did not tell you that we're out of the woods. We still are having positive cases. People are still dying, and it's possible for us to see a second wave. So I want us to remain vigilant and do the best we can to keep ourselves and each other safe. Thank you very much.
Thank you, Dr. Black, for that update from Phoebe Putnam Memorial Hospital. We will now hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good evening. I'd like to start off, to God be the glory. To God be the glory. To God be the glory. Things are getting a little bit better on the death rate. And I'm going to go through that with you to show you that as of April the 30th, 2020, it's getting better and slowed down, but we're at 119 positive death from the virus here in Dougherty County. In zip code 31721, we have 16 deaths. 31707, we have 25. In the east side, 31705 would be 26 deaths. In the south side, 31701, we have a total of 52 deaths. Females, we have a total of 64, that's 54%. Males, we have a total of 55, that's 46%. Females, we have a total of 27 whites, that's 23%, 1 Latino, that's 1%, and We have 91 black. That's 76%. We have 1 Latino male. We have 19 white female, that's 16%. We have 8 white males at 7%. We have 45 black females at 38%. We have 46 black males at 38%. Going by age, we have 3 in the age of 30. We have 7 in the age of 40. We have 6 in the age of 50. We have 38 in the age of 60. We have 33 in the age of 70. We have 80 in the age of 22. We have 22 in the age of 80. And we have 10 in the age of 90. The average age now is going back to 71. Death by location, we have 95 that have died in one of the hospitals. We have 18 that have died in the nursing home. 6 have died in the residence. One that have residents in the nursing home. We have a total of 33 that residents that lived in the nursing home that have died. And everyone else, 86% was in the resident or either somewhere else. The number of deaths by week. The first week we started looking at the death rate was March the 15th. From March the 15th through March the 21st, we have 10 deaths. The second week, March the 22nd through the 28th, we have 17 deaths. The largest week we had was March the 29th through April the 4th. We have 29 deaths that week. April the 5th through April the 11th, we have 25 deaths. April the 12th through April the 18th, we have 24 deaths. April the 14th, April the 19th through April the 25th, we had 7 deaths. And this week, starting April the 26th, up to now, we have 7 deaths so far. I want to say that I hope we have mentioned the death of this. Based on the symptoms that we had a few weeks ago was fever, cough, shortness of breath. Those what we were basing the test on, especially the one that had died. Now we see there's other symptoms out there. Tiredness, aching, chills, sore throat, loss of smell, loss of taste, headaches. These things are other symptoms. We are learning a whole lot about this virus. We are learning a whole lot more that we didn't know. I don't know, there might be other symptoms out there. But I want to say we as a people got to take care of our own selves. I don't need the governor. I don't need the mayor or no one else to tell me to take care of myself. I thought about, even though you can get tested or not get tested. You can be negative or positive. And some people may not never get tested. Number one line of defense, you're going to need prayer. The second line of defense I feel that you need is to wear a mask. The flu season is getting ready to come in. Colds are getting ready to come in. They're talking about a second wave may come in. If you don't protect yourself, who's going to protect you? My philosophy is this: everyone needs to wear a mask. As soon as you walk out your house, you need to put a mask on. And I took this picture because I wanted you to see that if the coroner is wearing a mask, you need to think you need to be wearing a mask. If a firefighter is putting out a fire and you stand around watching the firefighter, if the firefighter run from the fire, that means you need to run. If the police is in a battle with criminals and shooting them backwards and forward, if the police take off and run, that means you need to run. If the coroner is wearing a mask, that means you need to think twice. I might need to put a mask on. So I want to encourage you, as washing your hands, not touching your eyes, that's good. But I'm trying to say, wear a mask. If you get tested or don't get tested, if you tested positive, you wear a mask, that means you won't spread the virus. You keep it to yourself. But if somebody else got the virus and spreading it, you got a mask on, they're going to protect you a little bit. Some people, like I said, they want to get tested. So if you don't want to get tested, wear a mask. Everybody needs to wear a mask. When you walk in the store, you ought to start looking at the individual. Don't have a mask on. In a sense, that's like playing Russian roulette. When you walk out your house and don't wear a mask, that's a possibility that you can pick up this virus because you can't see it on the individual. You can't tell the individual got the virus by just looking at them. They can look real cute, wear makeup and everything else, wear a wig, but they can look very beautiful, but you can be carrying this virus. So I want to encourage you, as they have said from the beginning, wear a mask, because I think this is going to be a long time process wearing masks. You're going to probably have to wear masks to churches, to funerals, to weddings. You're going to have to start wearing masks. Look what they're doing in China. So we're going to have to get to the point to start getting comfortable with wearing a mask. I want to encourage you, keep wearing a mask, but I want to thank God again that the death rate is declining, but I want to get it down to 0. Thank you.
Thank you, Coroner Fowler, for your comments today and presentation. We'll pause now for any questions that anyone may have today. Okay, yes. Yes.
Okay, this is for the mayor.
Great. Mr. Mayor, I have a question for you.
Yes, ma'am.
Are the people who are doing compliance checks deputies and officers? If not, do they have identification? Because there are multiple reports of people showing up to claim they're doing compliance checks, and where can they be reported?
Well, to the best of my knowledge, the only people who are conducting compliance checks would be law enforcement officers. Now, I know the city did reassign some employees to help support the compliance checks, but correct me if I'm wrong, Scott.
We only have law enforcement
Yes.
doing compliance.
No one should be, the only people who are authorized to perform compliance checks would be sheriff's deputies and police officers of the Albany Police Department and Dougherty County Police Department. So please do not allow anyone who is not clearly an authorized, who's not a certified police officer or deputy sheriff onto your property under the guise that he or she is conducting a compliance check, because that's just simply not true.
We do have fire inspectors.
Oh, I'm sorry, and the chief has corrected me that the fire inspectors also have the right, but they would be in uniform.
That's correct, yes, sir. And have identification.
And have identification. Thank you, Chief.
Thank you.
Yes, ma'am.
Okay, are we seeing any non-COVID-19 related deaths in the community, and do you have a number?
I don't have a number yet, but we still having our regular cases that we normally see that have been tested negative, and also there are some individuals that have not been tested, but they had none of the symptoms. And at first, we didn't have enough tests to test everybody that died in Dougherty County, but we are now trying to test many as possible can, especially if they had symptoms or been around someone exposed to someone that was positive. Yes.
They're asking if there were any pre-existing conditions for the COVID-19 deaths.
Most of the death are pre-existing is diabetes, hypertension. Some had cancer, but most of them had diabetes, and that's one of the biggest underlying medical condition that we have seen. And most of the patients, I don't have the numbers or the exact, but I know diabetes, hypertension, and cancer are some of the ones that normally exist. Thank you.
I think we have one more in the back.
My question is actually about the regional COVID-19 task force, and well, how important is it for all these counties to be together to sort of respond to the state as we continue to move forward with the reopening?
I'm sorry, if you would please restate, I'll ask the mayor to come up and address your question on the task force.
I'm sorry.
So, Chair Joe, can you tell us a little bit about the importance of this regional COVID-19 task force that was announced on Monday, actually, and its significance as we continue moving forward?
Well, I don't think it has been formally created. I think the chairman of the county commission has asked the governor for authorization to create a regional COVID-19 task force. And the one thing, it was on the Department of Public Health website, the old picture's worth 1,000 words. They had 2 red maps of the progression of the COVID-19 throughout the state. And during the second week, as the coroner had mentioned, Albany and Dougherty County were a pink color. And then the next week, it was a brighter pink. And the third week, Albany was red, and Lee County and Mitchell County were pink. But as you see, at this point in time, all of southwest Georgia is now crimson. And the idea that Albany is alone in this would be a complete fallacy, because you see that other counties, Terrell and Randolph, I think now have a higher per capita death rate than we do, probably Mitchell County as well. And I certainly hope that we don't see these infection rates and death rates continue to increase, but that would be the point of having the regional task force, so that we could work in concert with other counties in other cities and counties in southwest Georgia to make sure everything is done to stop the spread of the virus.
Okay, any additional questions? Okay, we also remind the public that all the information you've heard today, if you would like information, maybe missed a number or like to write down a number, you can of course call the Emergency Operations Center at 229-302-1900. The Emergency Operations Center is open 7 days a week from 8 a.m. to 5 p.m. daily. So if you missed anything, they're standing by and can route you toward those resources. As we end today, we'll see you next week. We'll see you on Tuesday at 1 p.m. And remember, mask up Albany, mask up Dougherty County. Thank you.